Hello and welcome to Diplomatic Passport, your daily COVID-19 show that keeps you up to date with COVID-19 developments right here in Zimbabwe, the region as well as globally. This show is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing Munati. Let's get into the statistics over the weekend, and we see that we had 49 new cases of COVID-19 recorded yesterday, and this represents a 2.4% positivity rate, taking the number of weekend cases to just over 79, and 6 deaths were also recorded. The cumulative number of COVID cases now stands at 126,269. Of these, 118,792 are being recoveries, and that's a 94% recovery rate. The Zimbabwe has 151 hospitalized cases of COVID-19. Of these, 9 are new admissions, 31 are symptomatic, 72 mild to moderate cases, and 34 admitted have severe symptoms, while 14 are in the intensive care unit. Looking at the ongoing vaccination program, 8,395 people received their first dose yesterday, bringing the cumulative for the first dose to 2,845,148, while 14,130 received their second dose to bring the cumulative for the second dose to 1,863,136. Looking at the African region, total COVID-19 cases now stand at 8,039,647, while deaths reported are at 203,608, and this represents a mortality rate of 2.5%. Remember, Zimbabwe is just over 3% when it comes to mortality rate. The recoveries in Africa are standing at 91%, with 7,328,000 recoveries. Now, the Avenues Clinic has observed a moment of silence for all doctors and nurses and other health workers who lost their lives during the COVID-19. The pandemic has affected everyone differently, and it's a bit of a solemn occasion as they came together in memory of lost fellow frontline workers and professionals. It is important that we also come together in this time. So much pain and hardships and that has been caused by the COVID-19. As the COVID-19 pandemic continues, frontline workers are still reporting for duty, risking and taking the bullet to ensure that public health ensures, and most at risk are, of course, the nurses and doctors who literally are at the front line of this fight against COVID-19 as the public do approach the health care centers. But to adequately protect the frontline workers, the Ministry of Health has been conducting nationwide trainings to ensure that healthcare workers are equipped with information and also skills to minimize the risk. And Ministry of Health Director of Nursing Services, Dr. Lillian Dodzo, gives us more information on their trainings, which have the primary focus of integrated case management as well as infection prevention.
The objectives of this training today is to make sure we strengthen the knowledge and skills in screening, triaging, and management of COVID-19 cases. We also want to strengthen the training skills of the IPC focal persons and also the case management trainers, so that they are able to cascade the trainings to all the districts. And also we are trying to build up on teams even at district level. So these ones whom we've trained, they are going to cascade the trainings to the districts, and we are going to ask them to come up with the training plans and identify where the gaps are, and these are the areas where they are going to focus and train. We are also going to come up with the strategies in implementing the management and prevention of COVID-19 pandemic in the districts, and this will be done through introduction of site support visits. We are also here to introduce the tools that we've developed just after integrating as infection prevention and control and case management pillar.
Now, of course, these training efforts are also in tandem with the government's ongoing exercise of providing personal protective equipment, that's PPE, for the respective frontline workers, and also giving them priority when it comes to the vaccinations around the country's different vaccination centres. Now, the issue of food aid remains on demand, as such organisations that are involved had to continue their services and avoid risk of malnutrition. This means, of course, that public interaction with the vulnerable groups could not be excluded down to zero, since they do have that duty to prevent malnutrition. Sibongile Moyo, a monitoring assistant with the World Food Programme, shared with us what motivated her to stay in the trenches during the COVID-19.
On the front line since the outbreak of COVID-19 in Zimbabwe, right from the first lockdown experience till today. And I did not quit my duties because of fear of the pandemic, but I felt motivated and challenged to make an addition into saving lives of the vulnerable. So I've been traveling to the field to ensure all our project beneficiaries receive food assistance, and all operations at each food distribution point are safe from contracting or spreading the COVID-19 virus.
Now, in recognition of the resilience and work of the frontline workers, the World Health Organization, that's the WHO, declared 2021 as the year to celebrate our health workers globally. And WHO Director General Dr. Tedros Ghebreyesus called on everyone to stand in solidarity with health workers as they deliver their service.
Health workers are at the forefront of any disease outbreak. They are every country's most valuable health resource. Across the world, health workers have shown unwavering dedication during the COVID-19 pandemic. In appreciation of these efforts, 2021 has been designated the International Year of Health and Care Workers. Health workers are working day and night to keep us safe from COVID-19 and have been over a year now. Applause is nice, but that's no longer enough. We have a moral obligation to protect our health workforce. We must learn from the pandemic, implementing policies and making investments that lead to better protected and supported health workers. As we celebrate World Health Worker Week, let's listen to our health workers and amplify their voices. More than anyone, health workers themselves know what they need to be safer and healthier and ultimately more effective at their jobs. They know what it will take to end this pandemic and to prepare for and prevent future disease outbreaks. This week, I salute every health worker. Thank you for your relentless dedication and commitment. Thanks to you, the world is a healthier, safer, fairer place.
So the frontline workers are primarily involved with the fight against COVID-19, and the government continues with its vaccination program to ensure that you and I get their jabs. And as we know, Zimbabwe received a further 1.5 million doses of Sinopharm. That's between Friday, Saturday and Sunday. This will be additionally be boosted by another delivery that's expected tomorrow. So do expect another shipment that's coming in. Zimbabwe takes receipt of a further 1 million doses of Sinovac this time, as we try and keep the momentum on our vaccination program that has done so well. Even the Africa CDC has recognized that Zimbabwe is amongst the top 5 nations in terms of the COVID-19 vaccination campaigns, and we have been doing slightly over 50,000 vaccinations per day. And I think in Southern Africa, we are only second to South Africa. That has been managing slightly over 220,000 vaccinations daily. So kudos to the team that are leading and spearheading Zimbabwe's vaccination campaign. Well, this brings us to the end of today's program, A Diplomatic Passport, the weekday show that keeps you updated on the COVID-19 effort, Zimbabwe's effort, as well as the region and Africa's effort in as far as fighting the pandemic is concerned. The show is brought to you by ZTN in partnership with the Ministry of Information, Publicity and Broadcasting Services. My name is Blessing, and we're back again tomorrow, same time. Do make a date with us. It's bye-bye for now.